Hello friends, now we are going to study about one more very recent topic of PSM, that is disaster management. Okay, so the first question that comes from disaster management is, which ministry look for the work of disaster management? That is Home Ministry. Just like biomedical waste management, which comes in Ministry of Forest and Environment, disaster management also doesn't come under Health Ministry. The nodal ministry is Home Ministry. Now, who is the nodal person, the most important person who takes the decisions in case of disaster? That is our Prime Minister. Okay, the nodal person is Prime Minister of India. Because disaster is a very important issue, and you need to take rapid decisions. So you have Prime Minister as the nodal person taking it. Although unfortunately our own Prime Minister is biased, but he still has the power to take decisions. Okay. Now, second thing is, what are the usual type of disaster and which is the most common disaster? So, which is the most common disaster? Yes, you are right. Flood is the most common disaster. But flood comes under hydrological disaster. Okay, so hydrological disaster, this is the most common type of disaster. But under hydrological disaster, you have three type of disasters. The first is flood, and you were correct that flood is the most common disaster. Okay, then after flood we have drought. Like you must have heard about more than 50 farmers from Tamil Nadu, they came and protested in front of Jantar Mantar for a very long time, because most of the parts of Tamil Nadu were affected by drought during that time. So is the parts of Maharashtra. So it also come under disaster. Okay. Next is cyclones. For example, you all know tsunami and other thing. Na? They also come under hydrological disaster. Okay. So these are the three type of disaster. Now suppose as a doctor you went to a flood affected area. Suppose you went to Kerala during recent Kerala flood. So what are the two most important preventive measures which you will take as a doctor after going to flood affected area? Can you think about that? Any important preventive measures? Yes, any guess? Two most important preventive measures. What will be those? Think. Yes? No, it's not vaccination. Because vaccination, even if you give some vaccine to the children, it will take very long time to develop the active immunity. So vaccination is not commonly the most important preventive measure. The first important preventive measure is safe disposal of fecal matter. Because there is water preventive measures, and I am talking about flood, during flood. Okay, so the first is safe disposal of fecal matter. Because if fecal matter is mixed with water, no matter how many medicines you are giving, you cannot prevent occurrence of cholera and other gastroenteritis infection. Second thing is chlorination of water. Because the water that the people are drinking, it should be free from microorganisms. So you mix it with bleaching powder and chlorinate it. So second is chlorination of water. Now, as I told you that vaccination is not of very good use because it takes time to develop immunity. But there is one vaccine which we can give during floods. What is that vaccine? Measles vaccine. Okay. So only measles vaccine can be given during flood. You all know that we give measles vaccine along with vitamin A. Very good. Because vitamin A supplementation, it prevents complication of measles and it also prevents measles from occurring. So and it also gives immunity to the child. So along with vitamin A supplementation, we will give measles vaccine. Now, why we give measles vaccine but not other vaccine? The reason is that the incubation period, okay, we can write it as IP for measles. What is the incubation period for measles? What is the incubation period for measles? The incubation period for measles is 10 to 14 days. And what do you mean by incubation period? As you all know, incubation period means duration between entry of pathogen. Suppose some pathogen enter into my body and I coughed. So cough is my first symptom and entry of pathogen is the duration. So the time interval between entry of pathogen and appearance of first symptom, that duration of time is known as incubation period, है ना? मेरे अंदर कोई कीड़ा घुसा एंड देन मुझे खांसी आई, इसके बीच का जो टाइम है यही इंक्यूबेशन पीरियड है. So this incubation period is for measles, it is 10 to 14 days. But if we are giving a vaccine, the effect of vaccine comes within 7 days. That means before the infection of measles appear in the body of the patient, the vaccine effect comes before starting of infection. So vaccine can actually prevent from infection in this case, okay? But in other case, immunity develop after a very long time, okay? So what I'm saying is, but incubation period for measles vaccine, this is only 7 days. So effect of vaccine, it comes before infection, okay? Effect of vaccine comes before measles infection. Before measles infection effect appear in the person, the effect of vaccine develop in the person, okay? So that's why we only give measles vaccine. Now, the second thing that they ask from disaster management is about disaster cycle. What are the various steps in disaster cycle? And sometimes they also ask about the meaning of various steps that we do in disaster cycle. So the first step in disaster, any disaster, is occurrence of a disaster, okay? So suppose there is a occurrence of a disaster. Suppose a disaster happened. Now after disaster happened, what is the first thing that we do? We do rescue and relief. We try to save as many persons from it, and then we try to place them in some safe area. Now, in after rescue and relief, the next step is known as rehabilitation. Okay? So what do you mean by rehabilitation? Suppose, like take for example the recent Kerala flood. Suppose flood happened and now as a doctor team you went there, you shifted all those people in a nearby school. Is it rehabilitation? No. Because it's just rescue and relief. Rehabilitation means giving them their job back. Okay, unless they are re-employed, again employed, it's not proper rehabilitation. Now, after rehabilitation, the next step, which they most commonly ask, is mitigation. Mitigation. What do you mean by mitigation? Mitigation means decreasing the impact of future disaster. Okay. What can be the example of that? Think what can be the example of that? So the definition is decreasing the impact of future disaster. Okay, of future disaster. Can you give me some example of mitigation activity by which we try to decrease the impact of future disaster? Yes, good. For example, if we are making earthquake proof buildings, okay, so if we are investing enough money in making earthquake proof building, then whenever any earthquake occur, it will decrease the impact of that earthquake. For example, in northeastern states, you have all the houses one above another. So even if one house fell, it can lead to a very large catastrophe there. So, sorry, if you are making earthquake-proof building, you are decreasing. For example, sorry, during our MBBS, we used to go to various flood-affected area from our team of Aligarh Muslim University. So, in all the parts of, there is a very large part of Bihar, in the northern parts of Bihar, you will find that almost for every 3 to 4 months of year, since Nepal leave a very large amount of water and it gets stagnant in the northern part of Bihar. And there is a constant flood every year for 3-4 months in that area. So you will find that all the people in that area, now they are making their houses from a height of more than 2 feet or 3 feet or 4 feet. So now they are making their houses above. So even if water is there, it won't affect them. So in a way, they are doing mitigation, trying to decrease the impact of future flood by making their houses at a height which remain unaffected by the stagnant water. Okay, so that is there. That is mitigation. Now, after mitigation, this is one of the example of mitigation. After mitigation, what is the next thing? The next thing which we do is preparedness. We prepare for next disaster. Preparedness for next disaster. So, in mitigation, we try to decrease the impact of future disaster. Now, what we do next? The next thing is preparedness for next disaster. And that is actually the most important step in disaster cycle. And that is the step in which we Indians are lacking. We don't prepare for the next disaster and we only act when next disaster appears. So what happens is, it leads to loss of a very large number of lives and resources. Okay, so after the preparedness, the next step is occurrence of disaster. Okay, so how they are going to ask questions from this disaster cycle? First thing they will ask, which will happen after mitigation, and they can ask you, give you the option of rehabilitation, preparedness, and other thing. Second thing, they can ask you about the definition of mitigation and rehabilitation. Okay, so keep the concepts and the disaster cycle event sequence in your mind. Okay, next question that they ask from disaster management is about triage. Okay, so what do you mean by triage? Triage means we are classifying casualties. Classifying casualties. And why we classify them? To give efficient patient care. What do you mean by efficient patient care? See, the point is that during a disaster, there will be a very large number of patients coming to the casualty. So you will separate them into various categories in order of priority. And therefore, you focus more on those patients who need more of your time. Okay, so the first category, category 1 of a triage is red category. Red category. So under red category, you have all those patients who need life-saving surgery within 6 hours or they will die. So the first priority is category 1, okay, red category. So under it, patients who need life-saving surgery within 6 hours. Okay, they all comes under first category. Now, second category, category 2 is yellow in color, yellow category. And in yellow category, you have patient who need surgery within 6 to 24 hours. So this time you have less severe patients who need surgery, but it can be done within 6 to 24 hours. Okay, need not to hurry up in that case, but a bit of hurry up, not too much. Now coming on to category 3. Category 3 is green color. And you all know the meaning of green signal, na? To go on, okay? So under the green category, you have ambulatory patients. What do you mean by ambulatory patients? Patients who can walk, okay, with a bit of limping or other thing, but they can walk. So ambulatory patients who need dressings, okay, minor dressings. Dressings means we are just putting on their this thing, their we are covering their minor wounds and everything. That's all we do under green category. Okay, so ambulatory patients who need minor dressings, they are green category. Now after green category, we have category 4, which is known as black category. And black category is for moribund patients. Moribund patients means patients who either have already died or who are about to die. Okay, so moribund patients or dead patients, they come under black category. So that's all. The priority is red, yellow, green, and then black. So that is triage. But then we have to know about one more thing, that is reverse triage. Reverse triage. So reverse triage is done, it is done during war and mass casualties. So you all know what does war means, and during war there will be a large number of soldiers coming to for your urgent treatment and care. But what do you mean by mass casualty? Mass casualty means when you have more than 50 patients coming to your casualty at one time. For example, if there is a train accident near to your hospital, then there will be more than 50 patients coming to your hospital at one time. That is mass casualty. So reverse triage is done only in these two conditions, mass casualty and war. And in both of these two conditions, the first priority that we give is to green. And that's a very strange thing. We don't give priority to red or yellow here, we give priority to green. Why? Because as you know, green have those patients who need minor dressings. So in war, we try to do the minor dressings first and then look on the serious soldiers. And first do the dressings of the soldiers who are minorly injured so that we can send them back to the war front to fight. Go and fight. Come with some bigger injuries. So we send them back. Second is, if we have a mass casualty, suppose train accidents nearby. So then in a hospital which is having 50 beds, if most of the beds are occupied by those patients who need only dressing, then how can you give time and space to serious patient? So you first need to attempt green category patients, those patients who need minor dressing, send them home and then have your bed empty for the more serious patient. Okay, so that's why first priority is green, and then second priority is yellow, and then third priority is red. Because for red, we need to do surgery within 6 hours. So in the same time, we can save a large number of yellow category patients. So that's why we put red in the third priority. But it's just a guideline and you can take your own decision. But it's for more efficient management, this guideline. Okay. Now, after red, of course, the fourth one will be black, but you need not to look on the black category because they are already dead. So any health worker or health staff can look at the work. So that's all about disaster management, disaster cycle, and various questions coming from it about triage and reverse triage. No other question can come outside this much of disaster management. Thank you very much for listening.